Hello, my name is Michelle Michael, and I'm a recent graduate of the Doctorate in Nursing Practice program here at Kent State University. Today, I've been invited to share with you my DNP scholarly project titled Severe Paradoxical Low Flow, Low Gradient Aortic Stenosis Compared to Severe High Gradient Aortic Stenosis in adult patients treated with Transcatheter Aortic Valve Replacement, or TAVR. A significant proportion of patients present in clinical practice with severe paradoxical low flow, low gradient aortic stenosis. And despite research that shows unclear outcomes demonstrating increase in mortality, hospital readmission, and reduced quality of life, patients with paradoxical low flow, low gradient aortic stenosis do demonstrate benefit from aortic valve replacement. The purpose of my DNP scholarly project was to determine if patients with paradoxical low flow, low gradient aortic stenosis impact outcomes such as mortality, hospital readmission, and quality of life in my practice as a crucial step in determining if specific treatment algorithms can improve outcomes. All patients with severe aortic stenosis treated with TAVR in a single center from 2017 to 2021 comprised my convenience sample. Permission to use a national TAVR registry was obtained, and the project deemed exempt from IRB, both from organizational standpoint and Kent State University. A descriptive cross-sectional design was utilized to retrospectively analyze data with a final sample of 313 patients with high gradient aortic stenosis and 67 patients with paradoxical low flow, low gradient aortic stenosis. Baseline demographics, comorbidities, procedural and post-procedural characteristics, 1-year mortality, and hospital readmission were compared utilizing the chi-square test or the independent t-test depending on the type of variable, whether it be nominal or ratio level. The Kansas City Cardiomyopathy Questionnaire was utilized for quality of life, and this is a valid tool used historically in patients with congestive heart failure, and it's also been validated for patients with severe aortic stenosis. The paired t-test measured a difference between each person, and the independent t-test measured a difference among each group. For the results, among baseline characteristics and comorbidities, left ventricular function and atrial fibrillation were statistically significant. Atrial fibrillation occurred more commonly in patients with paradoxical low flow, low gradient aortic stenosis, and these patients also had a reduced EF compared to those with high gradient aortic stenosis. Complications among patients treated with TAVR were uncommon, therefore statistical analysis was not performed on this outcome. Quality of life was not statistically significant among groups. However, each person demonstrated improvement in quality of life using the Kansas City Cardiomyopathy Questionnaire, and this was statistically significant. Hospital readmission and mortality were higher in the paradoxical low flow, low gradient aortic stenosis group, but not statistically significant at 1 year. In conclusion, while outcomes following AVR in patients with paradoxical low flow, low gradient aortic stenosis have been unclear, this DNP project demonstrates no difference in clinical and functional outcomes between patients with high gradient and paradoxical low flow, low gradient aortic stenosis. Thus, procedural protocols to mitigate risk and improve outcomes in this patient population are unwarranted. Additionally, TAVR can be performed safely in high volume centers and may be the treatment of choice in patients with paradoxical low flow, low gradient aortic stenosis. Thank you.